range of motion, hip, knee, and ankle. Now, we've already learned range of motion. We learned range of motion shoulder on Monday. This is the exact same thing, just on a different body part. So remember, with range of motion, there's three things that we need to know. We need to know which body part, which exercises, and how many repetitions. We also need to know whether it's active or passive. Active means the patient will do the exercises. We're just there to encourage and prompt. Passive means that we do the exercises. The patient's not really actively performing them. So for the test, they're always passive range of motion. So the three things that we need to know now are what body part, what exercises, and how many repetitions. So the place that we go to find that information is always the care plan. And remember that the care plan is going to be different for every single patient that we care for. You may have a patient in room 2 that you're doing range of motion on the hip and knee on, and you may have a patient in room 4 that you're doing range of motion on the hip and knee, but the exercises are different based on the level of ability of that patient. You might also have one that you have to do 10 repetitions on, and a patient that you have to do 20 repetitions on. Remember that every care plan is going to be tailored for that particular patient's needs. Maybe one patient is a little bit weaker than another. Maybe one has mobility issues. Maybe one has pain. Maybe one is a little bit further along in their, in their disease process. So we don't know why the care plan says what it says, and frankly, we don't need to know why the care plan says what it says. Our job is simply to read that care plan and follow what it says exactly. So let's take a look at the care plan for this particular skill. Now, this is going to be found in your white skills book, the spiral book, and this is on page 57 of your book. So those of you who have your book, open up to page 57. So we always look at the care plan at the top of the page, and here you can see our care plan is telling us to provide the following range of motion exercises to the resident's right hip, knee, and ankle. So it says right hip, knee, and ankle. That means that that's the only one that we can do. Don't do these exercises on the left side too, because you want to show off and show the evaluator just how excellent your skills are. That's not what this is about. For whatever reason, the nurse does not want these exercises to be performed on the other side. Maybe they just had surgery. So don't go above and beyond here. It's the care plan, the whole care plan, and nothing but the care plan. So right hip, knee, and ankle is what we're going to be working on. This care plan tells us to perform flexion extension exercises. And if you remember, flexion extension is an up-down motion. We're going to provide 3 repetitions of the exercise, and the resident is not able to help. So that's our care plan. We now know what body part, the right hip, knee, and ankle. We know what exercises, flexion extension, and we know how many repetitions, 3. So let's scroll down to the bottom of the page so we can see what the test is going to say about this. And they estimate that somebody with your level of experience should be able to perform this skill within 4 minutes. So this is a super short skill. This is going to be done on a live person, so another testing candidate. This person will be positioned in bed at the beginning of the skill, and there's no charting required. So on this page, you can see all of the step-by-step instructions. So if you follow these steps exactly, do exactly what it says, you will pass the CNA state exam. And up here is your gray box right here. This gray box is kind of the abbreviated version. It helps you remember the important steps. So those are our orders to do this particular group of exercises. But hip, knee, and ankle is a little bit unusual for range of motion. It kind of doesn't go with like all of the same rules, because we're actually going to exercise both the hip and the knee at the same time. So this is going to be like a 2-for-1 exercise. So like with range of motion shoulder, we exercised the shoulder. So we brought the entire arm up and back down. We didn't bend both the elbow and the shoulder at the same time. Elbow is totally separate. So for this skill, hip, knee, and ankle, the hip and knee are going to get squished together and combined. And that's because that is a very natural body motion. So let me explain what I mean. So flexion extension, remember, is a up-down motion. So if you're going to flex your hip, right now it's extended, it's straight. That's how it normally is when you're standing, if you're going, or when you're laying down. If you're going to flex your hip, you're going to bend that hip muscle. So when you bend that hip muscle up to a flexed position, normally your knee is also going to bend. So if you've got a patient that's laying down in bed, and I'm going to turn this around so you can see, because I need a little bit more space to work with here. Okay, so I'm going to back up so you can see me. So right now, everything is extended. But if I wanted to flex the hip and the knee, I'm going to turn to the side. If I bring my knee up to my chest like this, like I'm climbing stairs, notice the knee is bent, and so is the hip. So to do this exercise is kind of a 2-for-1. When the patient is laying down in bed, you're going to lift the leg and bend the knee up to the chest and then all the way back down to the bed, and that bends both the hip and the knee at the same time. This really is a 2-for-1 exercise, and it gets both the hip and the knee at the same time. So we're going to do 3 repetitions of that. We're going to lift the leg, bend the knee to the chest, and all the way back down to the bed. We'll repeat that 3 times. Remember, we always go slow, smooth, and back to start. Then we're going to exercise the ankle. Now again, this is flexion extension. That's what our care plan told us to do. So we're going to bend the top of the foot forward, like they're stepping on a gas pedal, and then back to their head. And they're going to feel a little bit of a stretch along the back side of their leg. So this is forward and back to the head, but only to the point of resistance. Don't try to push further because you can actually tear a tendon. So to the point of pain or resistance. So once it gets, you encounter a little bit of resistance, that's where you stop. But we don't want the heel to be scraping along the sheet because that can tear fragile skin. It can leave, burn marks and other things because sheets aren't always like super, super soft. So we want to lift that leg off of the bed just a little bit, just so the heel isn't touching the mattress, so that when we bend the top of the foot forward and then back to the head, that heel is supported by our hand and not rubbing along the sheet. Does that make sense? One of the things that I want to do before I show you the video for this skill is I want to go through and review the principles that we've learned so far, because it's been 2 days since we were in class and you may not remember all of the little details. So let's look back here, way back there, and you can't even see it from here, but we have that green banner, which was the opening. Now remember, we have very specific principles for the opening. We have to knock, identify the patient by name, identify ourselves by name and title, and then tell the patient what we're there to do. So this time we would say, I'm here to perform exercises, or I need to do range of motion. However you want to say it is fine. You're not actually graded on the words that you use or how you explain the procedure to the patient. So saying, I need to do some exercises on your leg is perfectly okay. If you can't remember what to say, read it right off the care plan. I am here to perform passive range of motion exercises to the hip, knee, and ankle. You can read it right off the care plan. How you explain the procedure to the patient is not graded. The fact that you do explain is. Now, right after you explain, don't go anywhere else, okay? You tell them, I'm here to do exercises, and then you have to say, is that okay? You have to not just tell them what you're going to do, you have to get permission for that thing. So if you go through the opening and you say, hi, Mrs. Jones, I'm Patty, your CNA today. I'm going to do some exercises. Let me close your curtain, wash my hands. Is that okay? You did not get permission to do the skill. You got permission to close the curtain and wash your hands. You need to make sure that when you introduce the skill, when you explain to the patient what you're going to do, that you get permission to do that thing. Okay, so be very, very careful when you're doing your opening. After you get permission, then you close the curtain and wash your hands, and then you can go get your supplies. We'll talk about supplies in just a little bit. So for this particular skill, we're going to do the opening by saying, knock, knock, knock. Hi, Miss Jones. My name is Patty. I'm your CNA today, and I need to do some exercises on your right leg. Is that okay? I'm going to close your curtain. Let me go wash my hands, and I'll be right back. Then you'll close the curtain, wash your hands, and reapproach the patient. So the opening is the opening is the opening. We do it for every single skill. Doesn't really change. The only thing that changes, which we're going to talk about in just a few minutes with the opening, is sometimes you have to put the head of the bed up, but we'll get to that in the next skill. We also know the skill rules, and that's really where we started our journey, is with the skill rules. We follow the care plan, the whole care plan, and nothing but the care plan. We don't ever deviate from it. If we can't follow the care plan, we tell the nurse. But while we are following the care plan, while we're doing our skills, anything that's abnormal, anything that jumps out at you, any observations that you make, if it looks funny, smells funny, feels funny, then you need to report it. So if you're doing range of motion, but you notice that there's a really weird odor coming from the patient while you're doing range of motion, and you know that you bathed that patient, you know, earlier in the day, you might want to mention that to the nurse. Hey, Mr. Jones got a bath this morning, but he's kind of smelling weird. You know, it just, I don't really know what it is. Let the nurse know. Of course, we all know what urine smells like. We all know what BM smells like. So if it's a toileting related emergency, that's you. You can take care of that. But sometimes patients develop wounds and those have odors. Sometimes patients develop metabolic issues and those can have odors. Sometimes bacterial infections can have odors. And one of the most interesting ones, I think, is a Pseudomonas infection because it smells like grape Kool-Aid. If you're taking care of a patient and you're smelling grape Kool-Aid, you need to let the nurse know right away. Unless they've got a pitcher of grape Kool-Aid sitting right next to them, chances are they may have a Pseudomonas infection somewhere. So there are different metabolic conditions and different infections that produce different odors. So when you smell something, you really need to let the nurse know that you observe that. Same thing with anything you see. If the skin is reddened, the nurse needs to know. If an area of skin is very dry and patchy, and that's different from what they've been, the patient has been experiencing, you need to let the nurse know. If their skin feels warmer today than normal, you need to let the nurse know. So all of your observations are going to get reported. So we know the opening and we know our skill rules. We also learned privacy blanket in class on Monday. And remember with privacy blankets, we use a blanket anytime the patient is uncovered or undressed. They're there to provide privacy, but also warmth and to protect the patient from us. Remember that none of us would be overly comfortable completely undressing in front of a complete stranger. Just because you're being paid to do that job doesn't make it any more comfortable for the patient. So giving them that layer of emotional protection is important as well. And remember, that room is going to feel way colder to the patient than it does to you. So if you're not using privacy blankets, if you're just exposing the patient and thinking to yourself, well, I'm warm, there's no problem here, that's not the whole truth, because you may be warm, but you're fully clothed and you're very active. So your patient's experience is going to be a little bit different than yours. We also learned the closing, and the closing is way over here, this red banner here. Now the closing, there were lots and lots of steps to the closing, but the order doesn't matter to that for the first four. You want to make sure the patient's in a clean environment. We have to ask about comfort, and we're also going to ask about a magazine because that shows that we understand the importance of emotional comfort as well as physical. So we're going to offer a magazine. We have to give them their call light. We have to open the curtains. So clean environment, comfort, curtain, call light, however you do that, it doesn't matter what order those things occur. Just make sure you get all four. Clean environment, comfort, curtain, call light. Once you've done those four, then you will go clean your hands. But remember, once you've gone to that sink, once you've cleaned your hands, you cannot go back to the patient environment because you've washed the patient environment off of you. By going back in and asking the patient, is there anything else you need? If you touch anything in there, now you've recontaminated, and that hand washing you did doesn't count at all. You would have to go back and re-wash your hands. So the first four, order doesn't matter, clean environment, comfort, curtain, call light, do it any way you want. But once you get that done and you go clean your hands, you cannot go back to the patient. If you do, you have to go clean your hands again. And then once you've cleaned your hands, then you can chart if necessary. Remember, there are 4 charting skills: pulse, respiration, feeding, and drainage bag. That's it. 4 documentation skills. And if you get one, the evaluator is going to give you the documentation form before you start that particular skill. So you can, you can put that documentation form on the overbed table. You can put it on the bedside table. You can put it somewhere where it's very visible to you so you can see it. And at the end of the skill, it'll remind you, I need to document. Now, what if we're doing a skill that doesn't require documentation, like range of motion? Do we still have to say we would document? No, you don't. Documentation, you don't do anything verbal. You're not going to tell the evaluator when you're counting the pulse, I got 86, what'd you get? Documentation is not verbal. It's always written. So for the test, if you get a documentation form, you have to fill it out. If it's not a documentation skill, you don't have to say anything about documentation. It's not verbal. It's written, okay? So we know 3 of the principles so far. Today, we're going to learn a whole bunch more. But that's after we get this first skill done. But you already know the principles you need for this skill. You know the opening, you know the skill rules, you know privacy blanket if the patient is going to be uncovered or undressed, and you know the closing. Now, the reason that I bring that up is because for the test, remember, our skills page told us that this is going to be on a testing student. So you might be the patient for this skill. The patient is going to be laying in bed. The evaluator sets all of that up. They're kind of like the director of a play. They will set the scene. So they're going to have a patient get into bed and probably lay on top of the sheet. Now, remember that this person that you're doing this on for the test is fully clothed, right? You plan on going to the test fully clothed. They're not going to have you get undressed and put on a patient gown. So you are fully clothed laying on top of the sheet for the test if you're the patient. So privacy blanket doesn't need to be used because the patient's not uncovered or undressed, right? Patient's fully clothed laying on top of the sheet. But in a clinical setting, if that patient is just in a hospital gown, and we're bending that knee up to the chest and back down to the bed, you've got to move the sheet to make that happen. So now the patient is uncovered and undressed. So I need you to understand that for the test, privacy blanket isn't going to be required because your patient doesn't meet the need of the privacy blanket. They're not uncovered, they're not undressed, okay? They're laying on top of the sheet, fully clothed. But in a clinical setting, when you go to do this, think about the patient. Is there a chance that they might become exposed? If they're not fully dressed, is there a chance the patient might become cold during this skill? When you are taking the test, you are focused on that evaluator who's grading you. It's only natural. You are being graded. that evaluators, or those, because remember in Florida there's two, those evaluators have this checklist. They are checking off tasks as you do them, and you are trying to focus on them. You should not ever be focused on that evaluator, ever. They have no bearing in your life whatsoever. This is not about you. The test has nothing to do with you. And I know it seems counterintuitive, because isn't the evaluator grading you? What do you mean it doesn't have anything to do with me? For the test, that evaluator is not focused on you. They don't care about you. That evaluator is focused on the patient in that bed. So if you are focused on the evaluator, if you're trying to say things to the evaluator to pass, your focus is in the wrong place. So you don't have to say, I don't need a privacy blanket for this patient because they're fully clothed and laying on top of the sheet. You would be talking to the evaluator if you said that. And remember, you are not supposed to talk to the evaluator. You are supposed to talk to the patient. So if you can rearrange your thinking just a little bit, and instead of focusing on you and the evaluator, if you can turn that focus around to the patient and address everything to that patient, you'll be fine. So you wouldn't walk in and tell the patient, okay, we don't need a privacy blanket because you're fully dressed. You could, you could, but that that patient is not expecting a privacy blanket. They're fully dressed. They're laying on the bed. Why would you, why would you even say that? So remember that when you're trying to convey information, you're always conveying it to the patient, not the evaluator. So if you have to restart counting pulse, you would tell the patient, I'm so sorry, I lost your pulse. Let me retry. We're going to count again. Every piece of communication needs to be with the patient, not with the evaluator. And if you do that, if you turn your focus over to that patient, you will pass the test. You will, because now your focus is on the right place. And you won't do things that puts that patient in jeopardy. Remember, the evaluators are focused on that patient. That's where you should be focused too. So you don't have to say for a skill, I need gloves or I don't need gloves. I need a privacy blanket or I don't need a privacy blanket. I would document this, I wouldn't document that. In those situations, you're trying to get somebody to pass you on a test. That is not what this is. You are supposed to be demonstrating that you know how to treat a patient. So if it's not something that you would normally tell a patient, it's not something you really should be announcing out loud. So remember, all of your communication needs to be with the patient. So just kind of keep that in mind as you're going through the skill. Gloves are not required for this. We're going to get into that in just a few minutes. I've got a whole big long lecture on gloves in just a second. But gloves are not required for this skill. It's actually a very quick and easy skill. Remember, the test says that it should take somebody with your level of experience less than 4 minutes to do this skill. So I'm going to show you the video for this. Again, it's very short, very easy. Remember your rules. This video does not have hand washing in it, because we've already learned hand washing, and I don't take the time in the video to do hand washing. If you're not 100% on hand washing, go back and watch that video. You'll see that I say to the patient, I'm going to go wash my hands, I'll be right back. And then the camera cuts to me coming back to the patient bedside. But remember that for the test, if this is your first skill, you will be physically going over and washing your hands at the beginning and the end of the first skill. So let me show you this video.